Hello, and welcome to the Social Protection Podcast. I'm your host, Jo Sharp. This month, in partnership with Australia's Department of Foreign Affairs and Trade, we are continuing our special series on social inclusion. People with disabilities often face multiple and overlapping barriers to fully participating in society. These can include physical and environmental obstacles, institutional and social constraints, and the extra costs involved in accessing healthcare, assistive technology, transport, and care. And when those needs go unmet, people with disabilities face higher risks of poverty and exclusion from education, employment, and community life. In this episode, we'll explore how social protection systems can help address both the direct and indirect costs of disability, while also connecting people to services, care, and opportunities. With me now I have Abner Manlapaz, who's Senior Associate at the Centre for Inclusive Policy and coming to us from Manila in the Philippines, and Charles Knox Vidmanov, who's a Social Policy Specialist, that's for Inclusive Social Protection Disability at UNICEF. Welcome, Abner and Charles.
Thank you for inviting us.
Yeah, thank you so much for inviting us. I'm a big fan of the socialprotection.org podcast.
Abner, starting with you, in recent years there has been a growing body of research on the cost of disability. What are those extra costs that people with disabilities often need to navigate in order to realise their rights and participate to their fullest in society?
Depending on the disability of the person and the environment where they live, their needs are definitely varying. So it could be about the doctor's fees, the rehabilitation costs, the assistive devices, including their maintenance, travel costs going back and forth to your doctor or for the rehabilitation. And for some, they may need a special transport, which will cost a lot more compared to those who can use the regular public transport. And then there is also human assistance, personal assistance, sign language interpretation, housing modification. Like my house, I need to modify this so that I could get in and out and reach my bathroom. And then I think internet access is an emerging expenses, particularly for people who are in the digital space. Deaf people would require more internet data in order to be able to communicate. People who needs to use technology, per se. Those are most of the things that we need to spend for. But also sometimes, like me as a person who use wheelchair, I need appliances to help me do household chores. Like I need a washing machine. Where in the Philippines, those things are luxury. If I have a washing machine, I will definitely be excluded in the social protection program of our government, or having a refrigerator so that I don't need to frequently visit market, which is also very difficult to do because it's really not accessible. But I have met many families who cannot afford to buy the appliances to prepare the special food for their family members with disabilities. So they do it manually. And that also are affecting your productivity, because instead of doing more productive work, you have to spend a lot of time doing things that could be done much easier and faster with the appliances that you have.
Thank you. I know you've done some work on calculating some of those costs. For example, the costs of raising children with disabilities in the Philippines. You contributed to a UNICEF study that showed that a household with a child with disabilities in it needs to spend 40 to 80% more than families without children with disabilities to achieve the same standard of living. And poverty rates are 50% higher in households with children with disabilities. Can you give a bit of a sense of what those extra costs amount to?
The biggest cost is around healthcare, but of course, not everyone incurs high healthcare costs. It's only those people with significant disability, and it definitely varies. It could reach to 1 million per year, million pesos per year. So it really varies in terms of the cost. I remember, for example, they need to spend around 3,000. I think the transport cost is around 3,000 pesos already for children to go to school. And we're not yet talking about visiting your rehabilitation service provider and the regular checkup with a doctor.
Yeah, and just to give a bit of a comparison, the Pantawid Pamilyang Pilipino program, better known as the 4Ps, which is the main conditional cash transfer for poor households in the Philippines, provides between 2,600 and 5,300 pesos per month, depending on the number of children in the family, their age and level of schooling.
So even if you have no disability in many rural areas, for example, the school for high school is only one and it's in the center of the town. And so like a child with no disability needs to spend a lot of money for the transport costs. And that's why they cannot comply with the requirement of the program. Like you need to be like 80% attendance. So that means attendance of 4 days a week. So the amount of financial assistance and the requirement to comply it is not matching. So a lot of problem in the design of the social protection program, making people to comply with the conditionality when in fact the support is not enough.
Thank you for that insight. And it's a really great example, not only of how the costs of attending school make it very difficult for children with disabilities, but the idea that if you are part of a family that's receiving benefits, that in fact not being able to comply with that condition because you can't afford it can put the whole benefit in jeopardy. So it's a nice example of how all of those issues can come together and really exacerbate things for children, people and families with disability. Charles, addressing these costs and these kinds of barriers to participation ideally requires a whole range of different kinds of supports. We've talked quite a lot about, income and money, but also health support, along with providing access to those things that Abner was talking about, assistive devices, personal assistance services, and so on. What is the role of social protection in catalysing or fostering inclusion, given that range of needs? And where do we see this happening?
Thanks, Joanne. I think it's clear that the evidence shows that social protection systems are one of the most powerful tools or sets of tools in the government's toolbox to address the kinds of disability-related costs that we've been discussing. This is both via the cash benefit side of social protection that supports people with disabilities to cover these different kind of costs, but also the in-kind benefits and services that fall within the social protection system that reduce the scale of those costs that they face. So I'd say in terms of what do we need to foster inclusion, the first thing is to have meaningful social protection systems in place that have a good level of coverage and adequacy. And this is a big gap. Globally, it's a big gap in the Asia-Pacific region. I think the latest ILO data suggests that only around 30% of people with severe disabilities across the region receive any kind of cash benefit, and often these are quite low in terms of adequacy. But of course, it also matters not just the systems in place, but how it's designed. In particular, how can a system provide an appropriate level of support given this wide diversity of costs and support needs that people with disabilities have that Abner has described so well? And it's key that system also is really designed to support participation in all areas of life, including in the labour market. Now, maybe just to make that a little bit more concrete and to give a bit of an illustration, I think the kind of story of how Vietnam as a country has evolved its social protection, particularly its kind of non-contributory social protection system, is a really interesting kind of illustration of some of these issues. So I wanted to quickly tell a bit of that story, which draws on a report by the International Labour Organization. So if we look 20 years ago, mid-2000, the main non-contributory disability benefit in Vietnam was a kind of single flat rate, means-tested benefit designed for people with disabilities who are assessed as having incapacity or limited capacity to work, has issues from a kind of inclusion and participation perspective. The benefit was quite limited in coverage of people with disabilities, quite a low benefit level. Now, what we saw is, particularly in the early 2000s, the country made a number of kind of interesting reforms to this benefit, which were partly linked to the country's new law on people with disabilities. So what were some of the key changes? One was to remove the means test for the scheme so that all people assessed as having a severe disability were entitled to a cash benefit. The eligibility and assessment system were also reformed to remove the direct link to capacity to work, also expand beyond a more kind of medical approach to include assessment of functional limitations and support needs. And so these kind of combined changes, made it much more feasible that a person could be receiving this benefit, but also be, say, seeking employment where that was possible. And we see from kind of qualitative discussions, quite a number of people who receive that benefit are in different kinds of work. Some other interesting reforms were then, instead of having this kind of flat rate, same benefit for everyone, there are different levels. So people with more severe disabilities receive higher benefit levels. Also, family members who are providing care can receive a caregiver benefit. Children and older people also receive slightly higher benefit levels. And then beyond the kind of cash side of things, people who receive one of these cash benefits are also automatically entitled to fully subsidized health insurance. And so all of these changes, as well as kind of supporting inclusion, there's been an increase in coverage and increase in kind of adequacy of the benefits. The country still faces a number of challenges. There are remaining weaknesses, including the support being quite limited for people with more moderate disabilities. But I think what this captures is an example of a country trying to move beyond that kind of single benefit, focused on incapacity to work, to a kind of more multi-tiered, multi-layer package that's kind of recognizing those different kinds of costs.
Abner, can you tell us a little bit about what some of the ambitions are in the Philippines for developing more comprehensive and integrated support for people with disabilities? I know there are some interesting moves underway.
Happy to share. 15 years ago, we have this idea that the government should institutionalize disability support allowance program for all persons with disabilities. The first time it was filed was in the 18th Congress. And so it did not actually move very far. And then we were able to refile it in the 19th Congress. But it got stuck in the appropriation. The government says we don't have money and therefore it's difficult to implement this. But of course, if you are following the news in the Philippines, it's not that we don't have money. It's the issue of good governance. But I think the one that is very promising that being piloted by the Department of Social Welfare and Development is the social protection targeting children with disabilities. So there are few local government areas where they implemented it. And the main idea is to provide disability support allowance amounting to 2,000, similar to the proposed law. And then by design, there should be a kind of case management to assist children with disabilities and their family to access all other services identified, let's say doctor's fee or rehabilitation fees, transportation support, and family members, especially parents, they also receive livelihood assistance under the livelihood program so that they can increase the income of the household. And if they are not enrolled in the conditional cash transfer program, the PANAWIT, they are being helped to be enrolled in this program. So in that regard, I would say that it's promising, but of course, we need to be mindful as well that for this pilot, they are just targeting people who are poor. It's not for everyone. And I hope that they will drop this poverty targeting in the program when they implement it nationwide in the future. Another one that is on the pipeline is the personal assistance service. So me representing CIP and my local organization, the Life Haven, it is an OPD. We are leading the drafting of the personal assistance service bill. And there are also other initiatives that are ongoing being led by the National Council on Disability Affairs. So they are developing a 10-year disability strategy plan. They are consulting different stakeholders from different regions. And as well as they are also thinking about having the omnibus law. They want to put together one comprehensive law that contains the old laws that exist. But if old laws like the accessibility law, we need to amend it to make it more comprehensive and aligned with the Convention on the Rights of Persons with Disabilities, in particular Article 9. and many other laws.
Yeah, it just goes to show the complexity in this space. As you say, the needs are so varied, and bringing all of that together as the systems are growing as well is obviously a huge challenge. Charles, I wanted to ask you a little bit more about disability assessment, which you started to talk about when you were speaking about Vietnam a moment ago. So obviously, generally the first step in determining who is eligible for transfers of different kinds of support. What kinds of disability assessment systems best support inclusion for people with disabilities?
That's a central question, and I think you could see it as one of the biggest hurdles to building inclusive social protection systems for people with disabilities. At UNICEF, we see really quite a significant and a growing demand from countries, from governments that are very interested and seeking to kind of pursue the strengthening of their social protection system. But we're really asking, okay, well, how do we do that assessment, and how do we do it in a way that it is inclusive? So what makes a system inclusive? I mean, when thinking about this, we tend to kind of think of three main areas. The first one is kind of comprehensiveness. We want a disability assessment system that captures the broad array of dimensions of disability. And the context for this is that many disability assessment systems around the world use a very medical-centered model, whereas a more comprehensive approach will consider a mix of factors, including, yes, impairments, but functional limitations, different support needs, and how these fit into the wider environment where a person with disability is living. It should also consider factors such as how disability might have different aspects across the life course. We know, for example, that assessing children with disabilities has particular challenges. So you need an assessment system that captures those different dimensions. So that's comprehensiveness. The other thing is accessibility. Another feature of some of these more medical-centered models of disability assessment is they often require applicants to travel to limited, specialized health facilities, maybe in a capital city, maybe in a kind of regional or provincial hospital. And a more accessible model involves, to the greatest extent possible, that this assessment is happening at the community level, so it's much more accessible for people with disabilities. And then the kind of third part is that the systems are reliable and accountable. We need systems that are transparent, that are applied consistently across the country. This is really key for building trust of people with disabilities, but also a kind of wider range of stakeholders. And that requires good guidance, clear regulations, training of staff, a whole range of factors. I think encouragingly, quite a number of countries are pursuing these different approaches in different ways. The Vietnam approach I briefly described is, I think they're doing that with quite some success. Cambodia as well has rolled out a social and rights-based disability identification mechanism, and there are kind of similar initiatives in Fiji. This is kind of a hard nut to crack. There's no single model or solution out there. One thing to flag is UNICEF has been working with the London School of Hygiene and Tropical Medicine and a number of other actors to develop a roadmap on disability assessment and status certification. And the idea is that can provide guidance for countries on trying to make those systems more inclusive. So that's due for public consultation in June. So I'd encourage anyone listening to look out for that and be ready to share any contributions and feedback they might have.
Charles, I'll stay with you briefly for the next question because I'm interested in what happens next. Often, once you've had that outcome of the assessment, a lot of countries have disability ID cards or concession cards that are then issued and benefits accrue with those. And then similarly, some countries are investing in national registries so that all of the people who've been assessed and received the cards are in a database somewhere. What important functions do things like cards and registries serve? And what are the alternatives for countries that don't go down that road?
Yeah, so I think we can see disability cards. It can be a kind of important part of the mix when thinking about providing a mechanism to access different entitlements, be they social protection, be they subsidized transportation, or various other benefits within the social protection system and beyond. But I'd say there are some more or less kind of optimal ways to organize this. When you're addressing these variety of costs that people face, we're looking at a kind of multi-tiered, multi-layered set of benefits where different people receive different things. So in this respect, you want to avoid a situation where there's a kind of binary division between those who have the card, who get kind of the same undifferentiated support, and those outside who don't get anything at all. So Thailand's a country that's made a lot of progress in expanding cash benefits, entitlements to healthcare through its disability card system. but it still has some space to build kind of more of those differentiated levels and types of support. And that's something that's quite kind of active discussion on at a country level. And then, a disability card will often be kind of linked to a disability registry, and think about the different registry systems and how they might interact in a country. I think the key message is it's very important that the disability assessment and registry doesn't exist in isolation from other systems and registries, but rather we're thinking of that as providing a channel to a wider range of supports. So thinking about how there's linkages to other social registries, health management information systems, education management information systems, and you can have a kind of back and forth between them. An approach that has some limitations, I think, is where we think we can kind of do everything through one single or isolated registry. So, there's been a number of countries where they have a social registry in place. There's been a kind of positive intention to include simple questions on disability in those in order to expand some benefits. That's a kind of step in the right direction, but that doesn't replace a kind of comprehensive, more reliable, dedicated disability assessment system of the type I kind of described before. So kind of one interesting case in that respect is Cambodia. They've rolled out the disability assessment system I've mentioned. Now that's kind of linking to the social registry in order that people who are getting the country's family package benefit, a set of cash benefits, receive a higher benefit if somebody with a disability card is in that household. Those simple ways those different registries link together.
Abner, so bringing some of these ideas and concepts into the context of the Philippines, you worked on a pilot to develop a disability and needs assessment system for local government units in Batangas province in the Philippines. How was that assessment tool developed, and how did that assessment work?
When we received the request for the technical assistance, what we did first is to consult a few local governments and ask them what do they think about the idea of coming up with a disability and needs assessment system. And then when we received positive feedback from the local government, we started to make a plan of activities like who should be the stakeholders to be involved. Definitely the national government has to be there because we are really thinking about a national disability registry that the people will trust. But we are also aware of the community-based monitoring system. The idea of that is for each local government to have their own local database or that could be used for local planning to target people who are eligible to various social protection programs. So we first engage with the people who are in charge in this work in the Philippine Statistics Authority, and then the National Council of Disability Affairs and the Department of Social Welfare and the Department of Health. And then from there, we expanded who should be involved as well. So we have NGO, like Physicians for Peace, the allied professionals. Then we have the advisory or technical committee in the national level. And then we also included national organizations of persons with disability, like, for example, the Philippine Federation of the Deaf or the umbrella organization of the cross disability. So we have all of them in the national level, but we also have different stakeholders at the local level, from the local government, the community workers, the local organizations of persons with disabilities, the teachers, the local service provider, the parent organization of children with disabilities. So all of them are involved in the process every time. And then, of course, there is no perfect plan. Like, for example, we didn't realize that there's a lot of knowledge amongst child development workers, no? And so we involved them more. We did additional activities to learn more about their experience in the work that they do. And we discovered, for example, that actually in the Philippines, even the newly born baby up to 2 years old, we have our own tool already that they use, no, to screen if that child has developmental delays, which is already a flag in terms of whether this child has a disability or not. So we learn from these people. in developing the tools.
So you were developing a needs assessment system. Could you talk a little bit about what was the assessment model that emerged from all that consultation?
What Charles was describing is the framework that we are trying to follow, but the details of that is based on the consultation that we had. So people has been bringing up issues around health. So there are a module about the health conditions of the people. I mean, this system doesn't need to be only for persons with disability. Even if after using the tool, we said that you have no disability, but if we know that you have health conditions, you should receive the support from our government because we have programs for everyone, yeah, especially on healthcare. The second one is the functioning difficulty. We need to know in different domains, we assess the functioning difficulty and the kind of support that they need in order to perform certain tasks. So maybe you need an assistive device or human assistance in order to perform specific tasks. Yeah. And also the community, like the market, the church, and the supermarket. So we want to know their experience in those places, the banks, whether they can go there without problem. And if they want to go there, do they need support or not? So those are some of the things that we are trying to assess.
So what did you find in terms of implementing this model? Did it work in terms of being able to link individuals more broadly to some of those services that are available in the system?
Yeah, definitely, because you will be able to find out, for example, if they need support for accessing medical needs, no? So they are being referred to those services. They are provided with financial assistance if they need to. And if they need assistive devices, they can already count how many people are needing assistive devices so they can organize it. So, of course, there are many identified support needs that are not yet available, particularly on human assistance. So that's why we are doing something about it. And I'm very happy to say that actually the National Council on Disability Affairs are working now with the state university to do a more rigid testing and maybe refining so that the plan is to scale up the implementation. So it's no longer a pilot. But meanwhile, as this is being done, some LGUs are requesting us to do the training already. There are 2 local government who started to use that since last year. So people are really interested in this system so that they could do their work much better as a government officials handling disability affairs.
And it just goes to show because, many countries, including Philippines, as I understand, comprehensive data doesn't yet exist. And yet it's really interesting to hear how you connected the assessment you've done in one place and identified a gap around personal assistance and been able to take that into the broader domain. So I think sometimes the lack of data feels like such a barrier, but you can start with these small pockets the way you are and build out from there.
In those places where we had data, this is an interesting finding. Of course, we know that a lot of working age persons with disabilities are not working. We know that in many literature, many study, many report. But we also ask the question, why are you not working? And a lot of them think that because they have a disability, they cannot work. So this is something that needs to be addressed if we want to improve the employment rate amongst persons with disability. Because even if I talk directly to them, they think that because of their disability, they cannot work because of their disability. And this is a stigma of the individual, and we need to correct that. It's not just only about discrimination of the employee. First, we need to fix the problem within ourselves so that they can be our advocates to make sure that workplace will be non-discriminatory of persons with disabilities.
Charles, as we've discussed and Abner spoke about right at the top as well, people with disabilities often have higher healthcare needs. That's a big cost. How are countries expanding access to healthcare for people with disabilities? And what lessons are there on how these systems can best cover these costs?
Yeah, thanks. As you say, these healthcare costs often emerge some of the biggest costs that people with disabilities face, again, obviously varying from individual to individual. And indeed, in places where there's been analysis of things like catastrophic health expenditure, you often see that it's significantly higher among people with disabilities. And I think there's a strong linkage or kind of relationship to the broader social protection system. Health financing is often a kind of component of the social protection architecture. So there's a lot of kind of interlinkage. But this idea that if we're thinking about universal health coverage, we're thinking about population coverage, who is covered by different kinds of financing arrangements, the service coverage, what benefits and services are included, and then the cost coverage is the third dimension. So the extent to which costs are fully covered. So yeah, I mean, in terms of population coverage, at the end of the day, a lot is going to depend on the overall health financing model and how it's being implemented in the country, like mix the tax financed or more kind of contributory social health insurance models. And we see across the Asia Pacific region, all of the kind of species or variety of these models. And I guess what I mean is if the coverage is low for the population as a whole, it's likely also to be low for people with disabilities. And in some cases, we find it's lower than average, which is obviously a real issue. Now, I think there are some kind of notable measures which countries can take to accelerate coverage of people with disabilities. So perhaps the most notable is in countries that are pursuing that social health insurance model. Often what they've done is to include people with disabilities as assessed as having kind of fully subsidized coverage of health insurance. So as I mentioned earlier, that's what Vietnam has done. But it's not just being in the scheme. Another key dimension is the service coverage, and people with disabilities will likely be seeking a wide range of services within the healthcare system. But obviously a key question is the extent to which services such as rehabilitation, things like assistive technology are included in the healthcare benefit package. There's some debate about whether this is best achieved by just saying we include them in the general health care benefit package, or whether we can have some kind of separate or additional improved package of services for people with disabilities. So countries like Thailand, the Philippines, also in Yogyakarta in Indonesia have kind of followed a bit more that model of having something a bit more specific, although they kind of vary a bit in design. And then finally, it's really the question, to what extent are actually these costs covered? Again, just being in the scheme doesn't mean the costs are fully covered. Sometimes people have to pay a co-payment, maybe 20% of the costs. And these can get quite big costs if they're for expensive, complex services. So some countries have sought to reduce these fees for people with disabilities. And the kind of final component to keep in mind on the costs is then the role of cash benefits. Ideally, cash benefits are not being used to cover general healthcare costs. That's something that should be more under the health financing side of things. But cash can be really useful in covering some of those indirect costs, things like the costs of transportation to the hospital, maybe that a person with disability or somebody who's supporting them or accompanying to the hospital has to miss a day of work. That's where cash can play a really complementary role.
Abner Manlapaz and Charles Knox-Vidmanov, thank you so much for joining me on the Social Protection Podcast today.
Thank you, Joanne, and the Social Protection team for having us. It was really delightful to be here.
Yeah, thanks so much for having me on the podcast. It was also really good fun to be part of the conversation and discuss these really important issues.
Before we go, we like to end each episode with some quick wins. We ask a guest to bring in some recommendations for research, news or events that have sparked their interest and that we think you should know more about. Joining us for Quick Wins today is Sam Drummond. Sam is a writer, lawyer, disability advocate, and the host of the Building Inclusion podcast. Welcome to our show, the Social Protection Podcast.
Thanks for having me.
So we're really excited to have you on today to talk about your own podcast, Building Inclusion, which really sparked my interest when I came across it recently. Can you tell me who you're talking to and what you're talking about on Building Inclusion?
Building Inclusion stems from Australia's disability strategy, and that strategy outlines a vision for a more inclusive and accessible Australian society. And at its heart is the stories of people with disability achieving their potential. So it's not often that you get to hear real stories from all over the country about people with disability, but we've managed to go around the country and capture some true gems of people doing everyday stuff, but that a lot of people take for granted. But what we have tried to do is say what the barriers are to people achieving their potential and how we can remove some of those barriers.
And as you say, you do go all over Australia. I'm from the Northern Territory in Australia myself, so I was pleased to hear you up there for some of those interviews. Of all those amazing people that you talk to across the series, if you had to highlight one or two stories, what would they be?
Yeah, well, the strategy covers a broad range of topics. And so you could probably go into, any of them, including employment, where we went down to Tassie and saw someone who had had a stroke, a guy called Jim, and he can only use one arm, but he's essentially learned how to make a really good coffee with one arm. It's become his passion. I really liked that one. My brother's a teacher, and when the episode about education came out, he said, I've loved them all, but this one is my favorite, and I'm sharing it with all the other teachers at my school. I probably agree. When you listen to the education episode, you're transported to Toowong State School in Brisbane, and Toowong is just a local public school, but it's bilingual. Bilingual schools will teach part of their everyday curriculum, like maths or science, in English, and then some of it in another language. Most bilingual schools, spoken languages, Italian, French, Mandarin, but Toowong teaches in Australian Sign Language or Auslan. And I spoke with a grade 3 called Lefroy, who is deaf, and he spoke through an interpreter. He was one of the most switched on kids that I've ever met. I asked him what he thought of the 90% of students at the school who aren't deaf or hard of hearing and what they got out of learning Auslan. And he said simply that they used to look at deaf people and think they're different, but now they see we're all the same. And that's coming from a 9-year-old. That's the goal of true inclusion right there. Yes, we all are different, but in essence, we're all the same. And I think if we all took that lesson out of it, then the world would be a better place.
Yeah, I was really struck by the story of the radio producer who's visually impaired and managing a radio station.
For visually impaired people, the act of a listening format is essential. And for you to be able to do that is very empowering to be heard on any medium, and particularly on radio or podcast. I think it's really important.
So, as you mentioned, building inclusion is about bringing Australia's disability inclusion strategy to life through lived experience and those stories that we've been talking about. Can you tell me a bit more about how the podcast is delivering on or fits into that broader strategy?
Yeah, the disability strategy has different pillars, but overall, the focus of the podcast is on community attitudes. By using disability-led storytelling to reduce harm and challenge stigma and build public understanding, I don't think it's sugarcoating the experiences of people with disability. I think we can quite often have it really tough and we haven't got everything right. We still have a way to go to ensure people with disability are getting the support and the respect we need to live a life that we love. But the podcast is highlighting some of the great work being done in the community as a model, and where we're falling short. We're saying, here are the voices of people with disability telling us how to improve our own lives. Now let's listen to them. You mentioned you were from the Northern Territory, and I talked to a First Nations housing advocate, Leanne Caton, in the Northern Territory, and she raised a perfect example of what this looks like in practice. She said the folks in Canberra keep giving us funding for manual wheelchairs, and that's fine, except for half the year, communities are cut off, and you need a 4-wheel drive if you're going to go down the road. And so if you take that wheelchair out on country during wet season, it's just going to get bogged. And so that for me just wraps up that idea that if we're not listening to these voices, we're missing out on effective solutions that are genuinely going to improve people's lives.
And the other thing that really stood out to me, there's a great interview with a man who helped to make the iconic Sydney Harbour Bridge wheelchair accessible by installing a lift. And the point he makes, of course, is that by making these facilities more accessible to people with disabilities, we're making it more accessible to everyone, and that broader benefit as well. It's a wonderful show. And as you say, hearing people describe their own experiences and lives is really insightful and inspiring. Building Inclusion, Australia's Disability Strategy, is available on Spotify, and we'll put a link in the episode description. Sam, thank you so much for joining me on the Social Protection Podcast today.
Thanks for having me. It's been a pleasure.
This has been our special social inclusion series, produced by socialprotection.org in partnership with Australia's Department of Foreign Affairs and Trade. It has explored how social protection systems can advance the economic and social inclusion of vulnerable populations across the Indo-Pacific, in line with GEDSI principles, addressing gender equality, demographic shifts, ageing populations, and disability inclusion. With thanks to DFAT and UNICEF for inspiring our subject today and helping to connect us to guests. As always, thank you for listening to the Social Protection Podcast. This podcast is a production of socialprotection.org. You can find all of our episodes on the socialprotection.org website and on your favourite podcast platforms. Be sure to like, subscribe, and leave a review. Back next month. See you then.